So Andrea laid for 5 minutes on these foam rolls under each side of her pelvis, and then she laid on them for an additional 5 minutes while I leaned onto her sacrum, right at the middle of the sacrum, and approximately 30 pounds of force. And so now I'll take these out and we'll see how she's doing. So now I can get some spring mobility through her sacrum. I can take up the slack inferiorly through the ilium, and I can see her feet bob up and down. So the force is translating through her SI into her hips, into her lower extremity. And here is superior glide mobility. So that's good mobility. And let's look at the mid-thoracic rather. Sorry about that. And I cannot find that restriction. So line your back, please. Here is side glide. I can take up the slack and I can spring it, get a little bit of movement where we had none before. And here's posterior rotation. You're tight here and you're tight here, so you probably have the second most common pattern, which is a bilateral anterior ilium. So we're going to treat this further in a little while, but I'll show you the upper to mid body of the sternum. So here's lower, here's mid, here's upper sternum, and I cannot find that restriction. So if you take your glasses off, and traction at her temples, look at your feet bob up and down. Yeah. So let's have you walk a little bit. Just go down that way and back and tell us how you feel. So we have good sound effects.
So I feel like a belly dancer.
Oh yeah? So you feel more mobile.
Yeah, a lot more.
Yeah.
There's a lot more space.
What's really nice about this pattern is that it's a one-time correction. It would take a large passive force, another fall, to move that sacrum backwards, okay? But you are still a little bit tipped anteriorly on both sides. So lay on your back and I'll show you the treatment for that. So roll over onto your back.
Oh, sorry.
Yeah. So what we're going to do is have you hug your right knee and point it outside the shoulder. So it's about a 20-25 degree angle, and you're going to do that for 2 minutes. And I want you to do that every day. And then you do the same thing on the left side for 2 minutes. And that should help restore posterior rotational mobility of the ilium. But I feel like we've made good gains. It's a pattern that I see somewhat often, and the person almost always responds very dramatically, with the dramatic sense of whole body freedom and relaxation of that upper cervical spine. So it's interesting how we treat the upper cervical without touching it. We restored upper cervical traction mobility by freeing up your sacrum and your movement of the ilia. So this is called a posterior glide sacral fixation. And thank you very much for letting us film it. I appreciate that.
Thank you very much.
Thank you.